Hello and welcome to Traditional Chinese Medicine Infertility. My name is Christina Capothanasis. I am a licensed acupuncturist here in Hawaii, and I am a diplomat of Oriental Medicine under the National Certification Commission for Acupuncture and Oriental Medicine. I also serve as the Executive Director for the Hawaii Acupuncture and Oriental Medicine Association. Today we're going to be talking a little bit about infertility in terms of traditional Chinese medicine diagnostic methods and treatment methods. I'm going to explain a little the different syndromes, how we classify infertility, and give you a few tips on how to improve your chances at getting pregnant. Infertility affects approximately 10 to 15% of couples, and of that 10 to 15%, 35% are caused by women having problems, 35% are problems with the male, another 20% are problems where the male and female are both affected, and the last 10% are unknown causes. The causes cannot be determined. In Western medicine, they have lots of explanations according to the different female reproductive parts. As you can see in this slide, there are different parts of the female reproductive system from the cervix to the uterus. Problems can occur with the ovaries or the fallopian tubes or in the peritoneal cavity. Now with the males, they usually check for things like sperm concentration and sperm motility, how strong the sperm can swim. They also have wonderful advanced techniques for treating the problems that are affecting each and every part of the male and female. They can treat hormone imbalances and fibroids, cysts that may need to be removed, things like PCOS, polycystic ovarian syndrome, or endometriosis. And they've also come a long way in their treatment methods like the intrauterine insemination or in vitro fertilization. These techniques have a success rate of approximately 8 to 35%, depending on the technique and the age of the woman and the man and the problems that they present with. Now, traditional Chinese medicine takes a completely different approach to infertility. We look at the balance of things like qi, which is your energy, the blood, and the specific organs in the body. How do we do this? We do this by taking the complete patient history. We ask a detailed series of questions from everything concerning your sleep patterns to your menstrual cycle, from your appetite to your bowel movement. We also do something called pulse diagnosis and tongue diagnosis. These are our three main diagnostic therapies and diagnostic treatment methods, and we use these to get a complete picture of what's going on inside the body. Now, after we get a diagnosis, we can use different treatment methods like acupuncture. As you can see in this shot, this is a picture of the meridians on the body. The meridians are lines of energy that are flowing throughout the body from head to toe, in and out. And on these lines are acupuncture points. They can be stimulated in a variety of ways, including acupuncture needles, cupping, moxibustion, ear seeds, and a tuina or acupressure. In addition to acupuncture, we can also use things like herbal medicine. Herbal medicine is a wonderful treatment option for treating infertility cases, and we also recommend lifestyle changes to our patients. Different research studies vary on the success rates, but it's approximately 50 to 90% success rate using traditional Chinese medicine therapeutic means to treat fertility. What we focus on mostly in the imbalances is your liver, your kidneys, your spleen, and two concepts, stagnation and dampness. Today we're going to a little bit on the syndromes. We call syndromes. That's just subclassifications of of infertility. And we're going to see a little bit about what each organ is responsible for and what kinds of symptoms can be present with these different imbalances. So if we look at this next slide, we can see these are the main syndromes or patterns of infertility. The first one is kidney deficiency. Then we have liver stagnation. The third one is dampness. And the last one is blood stagnation. These are the main 4 patterns that we'll be focusing on today. If we start out with kidney deficiency, we can see that kidneys are responsible, they control growth, they control development, and they control the reproductive cycle and the reproductive organs. Now, the kidneys have something in essence. Essence is the energy or the chi that's keeping us alive, is our vital force. And this is passed down to you from your parents. So you can think of it sort of in terms of genetics, what your parents passed down to you. Some of the ways that the kidneys can be depleted or deficient is that, one, your parents didn't pass down a lot of kidney essence or kidney chi to you. Another way of depleting or damaging the kidneys is having an overactive life in the bedroom. This can also damage the kidneys. Third, we can see that after major illnesses, the kidneys can be depleted because major illness takes a lot of energy to fight. Also, women who have had several miscarriages, multiple miscarriages, we say in traditional Chinese medicine, every time you have a miscarriage, it's like having a child. So you're hurting not only the chi, but your blood. And then with age, the older we get, the less the kidney essence becomes. It becomes depleted with time. We have 3 different types of kidney deficiency. We have kidney qi deficiency, kidney yin deficiency, and kidney yang deficiency. But what these 3 types of deficiency have in common is that they present with symptoms of dizziness, possibly present with symptoms of tinnitus, which is ringing in the ears. Sometimes you hear buzz sound. And also you can have lower back soreness or aching pain all the way from your lower back down through your calves, through your thighs to your calves. So these are some of the signs that you have kidney deficiency. Now you can see you have more kidney yang deficiency, which is a lack of warmth in the body. If you're presenting with symptoms of coldness, and kidney yin deficiency, think of lack of fluids in the body, if you present with more warm symptoms. So the kidney deficiency is the first type of syndrome or pattern in infertility. Secondly, we come to liver stagnation. Now the liver is responsible for holding the blood in the body. It's also the other very important organ for controlling the reproductive organs. Now, if we have a very stressful life, which most modern people do these days, lots of stress, either physical, mental, or emotional, can cause the energy that flows through the liver to become bound and stagnant. This idea that the liver needs to be free and flowing, and it is unhappy when it is constricted and bound by too much stress, will lead to different symptoms in the body. A couple symptoms that you can see with people with liver stagnation is that easily irritable, maybe easily angered, they take deep breaths and sigh a lot, and they may have painful menstrual cramps or distended breasts before or during their periods. Now we also say that the kidney essence and the blood liver are interchangeable. So if there is a depletion in the kidney essence, the blood liver can come over and boost it back up to equal it, and vice versa. But when both of these organs are depleted from different causes, then they can both be depleted, and you can have depletion in both the kidney essence and the liver blood. This kind of organs affecting each other is very crucial. It's core to the traditional Chinese medicine diagnostic theory, because we see the body as a whole, and we know that all the organs and the emotions affect each other. Next, we come to the idea of dampness in the body. Now, dampness in the body is usually created by what we call spleen deficiency. In Western medicine, spleen deficiency is not that, the spleen organ is not that important. It's used mainly to destroy the red blood cells every 120 days. But in traditional Chinese medicine, the spleen is seen as the foundation of the digestive system, and it's very important. One of its qualities is that it helps hold things in the body. So if you have frequent urination, diarrhea, excess vaginal discharge, or multiple miscarriages, then the spleen might be one area that we need to focus on. The spleen has a rising energy and helps hold things in the body. If the spleen is deficient, it is not able to help the stomach transform and process your food correctly, so you come up with a sticky or damp condition in the body. This idea of dampness in the body is not something that is ideal for infertility couples. They may present with some digestive system problems. They may have loose stools. They may have nausea, slight dizziness, tightness in the chest, and these patients may be overweight. How does this develop? This can develop, one, by the kidney yang deficiency. So just as we said that the kidney essence and the liver blood are interrelated, we can also see a relation between the kidney and the spleen. The kidney needs to be warm enough to activate the spleen's function so that the spleen has enough warmth and energy to transform and process the food. So if we have a pre-existing kidney yang deficiency, that might be one explanation why the spleen is weak. We can also come back to our lifestyle, diet, and exercise. For those of us who are overweight, dampness is a very common condition seen in overweight patients. If you eat too much, that puts a lot of stress on the digestive system. If you eat food that is too heavy, dairy products, wheat, fried meats, oils, these heavy, rich products are also a lot of strain on the digestive system, and that easily creates dampness in the body. We also say that patients with polycystic ovarian syndrome, sometimes their symptoms correlate closely to the dampness syndrome in traditional Chinese medicine. The last syndrome that we're at today is blood stagnation. Now, blood stagnation can result from also several different causes. It can result from not having enough qi or energy in the body. Our heart is pumping our blood, but if we don't have enough qi to help the heart pump and keep moving, then the blood doesn't circulate, because the qi is responsible for helping the organs function and it is responsible for pushing the blood. The second reason for blood stagnation is yang deficiency. If there's blood flowing through the blood vessels, we'll use the analogy of water flowing through a river. In the winter, when the river freezes, the water has a harder time flowing through the river. This is the idea of blood stagnation. It's poor circulation. You can think of it in terms of poor circulation throughout the body. And when it's too cold, the body is too cold, the blood can't flow smoothly. On the other hand, yin deficiency, or not having enough cooling, nourishing, moisturizing properties in the body, can also result in stagnation. If we come back to the idea of a river, if there's not enough water in the stream, there's just a trickle, that also makes it hard for the water to flow freely through the river and or blood vessels and meridians where the energy runs. So blood stagnation can be caused by several different factors as well. And some of the symptoms that we see in blood stagnation are also painful menstrual cramping or distended tender breasts. But one thing that we'll see is having clots in the period blood, and the clots may be larger in size versus yin deficiency clots, which may be quite small. So these kind of clotting will indicate that there may be blood stagnation in the body. In addition to asking the patient history intake, we can also get a lot of information from pulse diagnosis and tongue diagnosis. In the tongue diagnosis, we can see in this cute picture here, there's a little baby sticking out his or her tongue. and the normal tongue is light pink with a thin white coating. But if you notice in the next slide, we can see that there are various types of tongues, not just the normal pink tongue that we saw with the baby or that you can see in the lower left-hand corner of the screen. There are tongues that are too red. There are tongues that are too pale. The tongue can be too small and skinny or too large. It can have thin coating, no coating that can be yellow or white. It can have special signs such as scalloped edges or red dots or purple patches. All of these different signs give us lots of information to how the spleen is functioning, to how the kidneys are doing, the liver, the heart, the lungs, the qi, and the blood, and the conditions of dampness and stagnation in the body. In addition to the tongue diagnosis, we can also look at the pulse diagnosis. In the next slide, you can see the different areas of the pulse that we take. We take both the left and the right hand because they represent different organs and different ideas. On the left, these three fingers together represent the blood. On the right, we have these three fingers that represent the qi. We can also take the different pulses separately, as you see in this slide. We look for the depth of the pulse, the speed, the powerfulness, the quality, the rhythm, and the strengths and weaknesses of the different organs. This helps us to have a complete picture of the diagnosis. And as we discussed, all the organs are constantly affecting each other. And even though the spleen, the liver, and the kidneys may be the main organs that affect patients with reproductive problems and today's topic of infertility, the patient can have more than one syndrome at one time. They may start with a kidney yang deficiency, which may be most pronounced, but it might also affecting their liver. If they start with liver stagnation, they also may have affected the spleen, because we say when you have liver stagnation, you're too stressed, the liver will eventually bind and attack the spleen. So this idea of too much stress weakening the digestive system is something that we can all think about in our everyday lives. When you're too nervous or too stressed, you might not want to eat, or you might overeat, or you might have diarrhea. So this idea is not a new idea, but it's something that we explain by the liver attacking the spleen in terms of Chinese medicine. Once we come up with a picture of what's going on inside the patient's body, we can start a treatment plan. The main treatment plan that I use for my patients is herbal medicine. Now, herbal formulas are usually composed of about 6 to 12 different herbs, and they are brewed into something called a decoction or a tea. And today I brought a few herbs to share with you so that you can see some of the herbs, commonly used herbs, for the syndromes that we've discussed today. So if you'll come over here and look at these herbs here. We have in the first category here, we have guiban and lu jiao jiao. These are two herbs wonderful for boosting the kidneys. This is boosting the kidney yin, and this is boosting the kidney yang. In the next set of herbs here, we have two herbs that are great for clearing any liver stagnation. So the people who are overstressed or over-worrying, things like xiangfu or caihu can help those patients. Next, we have the herbs that are used for conditions of blood stagnation. Honghua in the front is a very strong herb to move the blood. And in the back here, we have dangui, which is not only used to promote blood circulation, but it's also used to boost the blood, to regulate the menstruation, and to promote bowel movement. So in about 90% of formulas, you will probably see the addition of this herb gui. In our last pair of herbs, we have a couple examples of herbs that are used for the conditions of dampness in the body. We said that the dampness is usually caused by a spleen deficiency. So these herbs not only help dry up the dampness, but they also help to build up the spleen and the digestive system. In the front here we have baizhu, and in the back we have fuling. So from all these herbs, and hundreds more, but these are some of the main ones that you can think about for the conditions we talked about today. They can be brewed together in a decoction, and we usually have the patients soak the herbs for about 20 to 30 minutes and then simmer them for another 20 to 30 minutes. You strain the tea that's boiled out of it, and you discard the herbs, and you drink the tea approximately 2 to 3 times a day. Now, the tea does not taste that bad. Lots of patients say it's okay, or some of them even like the taste. Some is sweeter. I don't usually use a lot of bitter or foul-tasting herbs in my formulas. The next kind of treatment therapy that we use is acupuncture. And as we discussed, there are lots of ways to stimulate the acupuncture points. Today, what I would like to do is share with you a couple tips if you've identified with any of the syndromes that we've discussed today. Maybe you could use these to benefit yourself. So first of all, we will look at the calf and ankle area here. The inside of the ankle and calf is where 3 meridians run. It's the 3 meridians of the 3 main organs we talked about today: the spleen, liver, and the kidneys. So this area is excellent for all female problems. And if you want to start massaging from down by the ankle, up behind the ankle, and squeeze up the back of the calf until about halfway up, you'll actually be hitting several acupuncture points that are good for women in general. So this is a wonderful kind of maintenance thing that you can do to help balance the hormones, promote good digestion, and boost the qi and energy in the body. The only contraindications for this point specifically is if you're now on your period, or if you're pregnant. This point can stimulate uterine contractions. So for people who are on their period with excessive bleeding or who are pregnant, this point would be contraindicated. But for women in general, even for those going through menopause, points along here, if you massage those daily, those would be great for you. Another couple points I'd like to share with you are danzong. This point is used for the people who are under a lot of stress, who are overthinking, overworrying, and this point is right on the sternum, the bone here on your chest, in between the nipples. So if you just take the palm of your hand and massage in a circular motion here, some people just instantly take a sigh, a deep breath of relief. This qi is called danzong, and it is the great qi regulator. So if there's any kind of stagnation in the qi or the blood in the body, this helps get that qi and blood moving. It's also very calming, so if you're under a lot of stress or you can't sleep well, this point is really great for that. The third point I'd like to share with you today, we can find it by putting our thumb in the direction up and coming over to the highest point of your forearm here. If you massage in the highest point of your forearm here, you should feel a little soreness, because this point is sore on 99% of people. This point is called Shou San Li. Actually, there's 3 points right here together, but Shou San Li is excellent for regulating the digestive system and helping to move the qi, circulate the qi, and get out some of the dampness for those of you who have poor digestion or eating too heavy diets. And this goes for the same on the other side. If you can see this right about here on the top of the forearm. That goes for the same in the legs, both sides. Acupuncture points are mirror images of themselves on each side of the body. When you go for an acupuncture treatment, usually needles are into several points along the body, and they are left in the patient for about 20 to 30 minutes. Sometimes electrical stimulation can be applied, or other methods can be used to stimulate the points, like cupping, moxibustion, tuina or acupressure, and ear seeds can be left in the ears for a few days. The patients can press and stimulate different organs. In addition to herbs and acupuncture, we also like to recommend lifestyle changes. Today I'd like to share with you a few lifestyle changes that I think are helpful for all infertility cases. The first one being diet. In traditional Chinese medicine, we have a separate category for Chinese nutrition, and it uses the same principles to classify foods that are used to classify herbal medicine. So it has the idea of cooling and warming. Bananas are cool where mangoes are warm. Bitter melon is drying where eggplant is cooling, but it promotes blood circulation. And in Chinese medicine, we say that dairy products, milk, butter, cheese, yogurt, ice cream, are all damp and create heat in the body. And these are both things we want to avoid. So I really highly suggest eliminating dairy from the diet to help with infertility cases. Also, a lot of dairy has extra added hormones and antibiotics, both unnecessary for us to be ingesting. Second of all is the issue of exercise. Everybody has a busy life and it's sometimes hard to fit exercise in, but 20 to 30 minutes of brisk walking every day or every other day is sometimes just enough to get the qi moving, to clear out the qi and blood stagnation, and to help transform some of the dampness. Lastly is sleep. A lot of people don't make time for sleep. Maybe they have insomnia issues, which could also be helped by traditional Chinese medicine. But in Chinese medicine, we say that the day is regulated by yang, or the heat and active qualities of life, and the night is regulated by yin, or the cooling, calming, moisturizing qualities of fluid. And it's really important for the body to be regenerated at night. So we recommend that women and men, if they could go to sleep by 11 o'clock at night and sleep for 7 to 9 hours. Sometimes these simple lifestyle changes can make a big difference, and they can show up in the tongue and the pulse. I'd love to speak more with you today, and if you have any more questions, please give us a call at 808-221-9814 or email us, and you can find our email and phone number at the end of the show. Thank you for listening, and we'll see you next time.